From the New South Wales Aboriginal Land Council, this is the A Cuppa and a Yarn podcast.
Hello and welcome to A Cuppa and a Yarn from the New South Wales Aboriginal Land Council. I'm Michelle Aleksandrovics-Lovegrove and I'm here today working from home and talking on the phone on World Health Day with Tameka O'Donnell. Tameka, thanks very much for having A Cuppa and a Yarn today.
Thanks for having me.
Now, just so people get a little bit more of an idea of who you are, I mean, Tameka O'Donnell is a nurse, so very, very qualified to have a yarn on World Health Day, being the Year of Nurses and Midwives. You're also a member of the New South Wales Aboriginal Land Council Youth Advisory Committee. So, Tameka, first of all, can you just tell me a little bit about yourself? Who's your mob?
Yeah, so like you said, my name's Tameka O'Donnell. I'm a Bark and Jubilakali woman from far west New South Wales. So I grew up in Broken Hill, moved to Adelaide to study and have made my way around back to Broken Hill, Newcastle, Sydney. So, yeah. You've
travelled around a bit.
Travelled around a bit.
Yeah, and we know each other. We've met because you are a member of the NSWALC Youth Advisory Committee. So tell us a little bit about the type of work that you're doing there with the committee.
Yeah, so I got involved with the advisory committee as I've been a member of the LAUC since turning 18, currently a board member for the Broken Hill Local Aboriginal Land Council, and seeing the opportunity come up last year, so decided to apply and was lucky enough to be successful in my application. So we meet a few times a year at this stage, and have worked on our forward working plan and youth engagement strategies, working closely with our zones and our councillors and the whole NSWALC team. So very busy. I've also been lucky enough to get the opportunity to go to the UN. Conference has been postponed due to the pandemic, but looking forward to hopefully revisiting that option later in the year.
Yeah, later in the year or next year, fingers crossed, when it's safe to do so. Yeah, and look, as I mentioned before, you're a nurse, so you, until reasonably recently, were working at the John Hunter Hospital in Newcastle, yes?
Yes, yeah. I've worked there for about 2 years and have just started a role at the Aboriginal Health and Medical Research Council with their registered training organisation. So basically just training and assessing for certificate 4s for primary healthcare and primary healthcare practice. So training up Aboriginal health workers and practitioners.
And what a time to be doing that type of training. Have things really ramped up at AHNMRC because of the COVID-19 pandemic?
Yeah, so generally we do face-to-face training, which has all had to go to an online platform, which has been a lot of work, but we've seen great results, and our communities and students are very engaged and enthusiastic about their training. So, and we have a great team with lots of support. So, but it's just been a transition, but definitely optimistic about online delivery and getting our Aboriginal health workers and practitioners trained up.
And you were mentioning to me earlier before, I started recording that you're actually back at Broken Hill at the moment, yeah? You've left Sydney?
Yeah. I decided to leave Sydney for the time being due to the pandemic and be with my family. So back in Broken Hill for the foreseeable future.
Yeah, and there are COVID-19 cases there though, but only a few, fingers crossed at this point.
Yeah, there's been 2 confirmed cases, so it definitely shows that the virus does not discriminate to where you are and unfortunately has reached these rural communities. So definitely very scary times and very stressful times, but I'm sure we'll all get through it.
Yeah, well, we've just got to adhere to the advice and the guidelines and the rules, the new rules on our movements and hygiene and that sort of thing. I wanted to ask you, Tameka, before we sort of get into, the theme of World Health Day for 2020, you being a nurse, you've probably been asked. I always ask people. People say I'm a such and such. I always say, why? Why did you become that? Why did you want to become a nurse?
I guess it's that cliche saying I've always been a caring person since I was younger, and I remember being in hospital when I was a child a lot for asthma, and I had some great nurses and made me really interested at a young age. And I was lucky enough to grow up with some really great role models, and particularly in Aboriginal health. And I kind of started getting more interested as I got older, and realising the health disparities for Aboriginal and Torres Strait Islander people, and the gaps across the board made me very passionate for health. So decided that nursing was where I wanted to be. So straight out of high school, went to university and got my degree, and I absolutely love it. It's creating change at all levels, and being there for mobs, and learning something every day. It's a vast opportunities, and it's a very, very fulfilling job.
And it's a very hard job too. I mean, it's hard work, nursing. No.
Oh, it definitely is. As like any job, it's got its negatives and it's got lots of positives. So that gets me through it. And at the end of the day, I enjoy going to work, and I'm grateful for that.
So with today being World Health Day, Tameka, the theme this year is support nurses and midwives. Now, this is part of that international year of nurses and midwives.
Yeah.
How important, and let's put pandemic aside for a moment, how important is it that we really acknowledge the work of nurses and midwives generally?
I think nurses and midwives have some of the most important jobs in the world. Where I've always been at the front line of everything. It's a very challenging job, very emotionally draining, but also very rewarding in the same sense. So, the nurses are the ones you see, the ones that will listen to your stories and support your needs as patients and clients. And we really support as people as individuals, and we really do care at the end of the day about everyone. So I think nurses and midwives are very, at the moment obviously it's a bit different, but I think previously it can be a very underrated and taken for granted job.
Well, there still is that sort of the general thing. It's, you're a nurse or you're a doctor and you can do all this sort of stuff, and nurses are only there to support doctors. But I'm not a nurse myself, but that's really not true. I mean, there's a high degree of training to become a registered nurse. And I'm talking midwives as well, but certainly from your personal perspective.
Oh, yeah, definitely. Lots of training, and it's, not just going to university and getting the degree. It's, constant developing your skills all the time, every day. It's more training. It's, health is ever changing. There's always more studies and there's always more research, and there's always changes to how to conduct best practice. So it's definitely a journey.
You're listening to A Cuppa and a Yarn. I'm Michelle Aleksandrovics-Lovegrove. I'm speaking with Tameka O'Donnell for World Health Day 2020. The theme this year is support nurses and midwives. And we're talking about the work of nurses and midwives and acknowledgement of the importance of that. And Tameka, especially now, the COVID-19 pandemic, you mentioned a minute ago that maybe not now, but there's this general sort of understanding that perhaps the work of nurses and midwives is underrated. Do you think that's changing, seeing how crucial nurses are in this fight?
Yeah, I definitely think perspectives have changed. it's definitely not our first pandemic that we've gone through. But I think now with social media and everything, that the awareness is a bit more broad, and it's looking at the stress it's putting on the health services, let alone the staff. So the sacrifices that nurses and midwives and other health professionals are making during this pandemic, are just amazing. People are, stopping seeing their own family, their own children, their partners, due to being on the front line and being exposed to this virus every day. So, getting prepared to look after what could be a high amount of cases, especially critically ill, and still having to work with long COVID stuff, just because COVID's around doesn't mean all other diseases and illnesses and injuries stop. So, they're still doing what would be a normal work day on top of having a pandemic. So, definitely thank any health worker, any nurse, midwife next time you see them, because it's stressful being on the outside looking in, let alone being there. So
absolutely. And your point is that other illnesses, other diseases, other injuries, nothing else has stopped. This is just added to everything else. Everything else is trucking along as it always did. So,
and they have stopped non-essential surgeries and everything. But babies are still being born. People are still falling ill. Just because the pandemic's here doesn't mean that all stopped. So it's definitely a high stressful time for everyone. And just I guess thanking all the nurses and midwives who are constantly devoting themselves to health, to their jobs. And it's not just a job; it's that way of life. It's that.
Yeah, I was thinking earlier, sort of stopping down and really having a think about midwives. I just went, gee, that's business as usual. Babies are still being born, but you're delivering babies at, during a pretty serious pandemic. It's just, the mind boggles anyway to think that we're greeting life, as well as farewelling more lives than we should be at the moment. So
yeah, and it's it's definitely hard. It puts a strain on midwives as well, because they have to continue providing this high quality care when they are limited because of the pandemic. Restrictions on visitors, and trying to support these mothers and fathers through what's one of the happiest moments in their life, but having to restrict their family coming in, and if someone is sick, if a partner's sick, if they can't be there for the birth of their child, it's definitely an emotionally straining factor into how we provide care, and not to mention with all the changes in visitations and trying to best keep our hospitals and staff safe. There's been aggression, and I guess just that people, as much as we can be empathetic, it's trying to keep everyone safe, not just our patients, but the staff as well. So
absolutely. And so regarding those precautions, because we have heard a lot about, shortages of masks and PPE and all that sort of thing. What sort of precautions are nurses and midwives, or I guess people working in medical care, having to take so that they can continue to do their work safely?
I guess it's just that appropriate use of PPE, hand hygiene. If they're sick, they should be staying home as well, which, with how things progress so suddenly with the pandemic, it's quite hard in terms of staffing and workloads. But, you know, I know nurses and midwives who, you know, get home and they're stripping at the door, showering before they see it. And like I said, and the ones who have completely shut themselves off from their family to try and protect their family from the risk that they get from going to work every day. But, yeah, I guess it's just following their local policies and, you know, what's dependent on where they're working and what best is suited for that health service. So we'll have different policies and plans in place ready for this pandemic.
With keeping themselves safe, and I have read a bit about the sorts of things that nurses in particular are doing, as you've mentioned. And I've also read about, you know, some instances where, unfortunately, nurses are actually being abused by members of the public. This is in Australia. This was in Victoria the other day. A number of occasions, like not on anyway. But what can we do as a community generally to support our nurses and midwives, especially now?
I guess it's following the directions of government and, you know, the health authorities know self-isolating and social distancing is going to be the biggest factor in how this pandemic turns out. So, you know, staying home, only going out for essentials, you know, not, you know, we can't say when this will be over, but, you know, we definitely know it's going to be for a while. So following them now will really prevent the outbreak worsening. You know, that don't see someone, you know, I don't understand why people are abusing our health workers. You know, we don't know why that person, you know, if they're in their uniforms and stuff, you don't know what they're doing. A lot of places are actually implementing that they don't wear the uniform. To after work or to work, they still wear their casual clothes. And that is to fight also the spreading of the virus. But yeah, definitely, you know, staying home. If you see health workers, give them a clap. You know, we don't know how their lives are at the moment, and that goes for everyone. That, you know, police as well, who are also getting abused. Just it's quite saddening to see that's what some of the reactions are from our communities.
As far as our communities go, you know, Tameka, I was fishing around and trying to find some up-to-date data, which I couldn't really. You know, maybe I'm looking in the wrong places, not looking hard enough, but the latest I found was, you know, 3,000 plus Aboriginal and Torres Strait Islander nurses and midwives in particular. So it's a pretty small group. Saying about 1% of the population. And this is old data. This is from 2015. So it's obviously a group that we'd love to expand. So what would you say to any Aboriginal Torres Strait Islander people who might be considering becoming a nurse or a midwife?
I would say do it. It's such a rewarding career. There are so many opportunities and different places you can work. What it does for Aboriginal and Torres Strait Islander people in our communities, you know, it really does close that gap. It's 100% would recommend to anyone considering it to do it. I don't think you'll ever regret becoming a nurse or a midwife. And, you know, if you decide, like, you know, and if you do and change later, you know, you've still got that background. Definitely a challenging road, and, you know, studying is always hard no matter who you are. But we're lucky enough that there are support networks. There's, you know, not a day where I'm not smiling about my job.
Wow.
Yeah.
You've currently swapped what people are calling the front line now for a different type of floor. You know, you're training Aboriginal health workers, all different types of health workers, you know. So we're talking about nurses and midwives today because that is World Health Day today, is those people. But in terms of the work you're doing now, sort of in that training realm, how's that sitting with you?
Yeah, I love it. I've always enjoyed that kind of teaching, education role, and I see the importance of Aboriginal health workers and practitioners. You know, they are so important to the health of our people, and I'm quite honoured to be able to train that next generation and those health workers and practitioners who are coming out. It's definitely different to, I guess, that nursing on the floor. But I'm lucky enough with nursing that I can still work in that space. I'm not limited to, like, I don't have to give up working on the floor. I can get work casually if I wanted to in doing that. And, you know, it's, yeah, definitely a new space, but I'm loving it, and I'm lucky I've got a great team that I've worked with, great organisations, very enthusiastic learners, and yeah, definitely, again, it's just that nursing and midwifery can take you anywhere.
Well, I don't know, can you hear this? I can't see you, but you know, we're having to record this in, people listening, we're having to record it in audio only, whereas we could have done video, but we have to do audio. So I'm clapping you and your team and the people at AH&MRC, because the more we train and encourage our people to have these roles and follow these careers, from me just as a general person, we're going to have cultural safety in our medical system for our mobs, etc. So thank you. Thank you very, very much, Tameka.
Thank you for chatting with me today, and you know, I just want to send my love out and my strength to all our communities. You know, it's very difficult times, and we're all feeling it. You know, reach out on the phone to your family members, to your friends. If you're having trouble coping, reach out to your medical services. You know, we're all in this together, and such important time to lean on everyone via the phone. You know,
or FaceTime.
Keep eye out for appropriate information. Don't read everything on social media, and just keep each other safe.
Tameka O'Donnell, thank you very much for a cuppa and a yarn.
Thanks, Michelle.
You can do Nayania Baraya, Nayania Manania, Manania, Manania.